Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Logan St. Cyr, palliative medicine specialist with Terrebonne General Health System. Today we're going to be discussing her role and the vital service that she brings to our community. Welcome to the show, Dr. St. Cyr.
Thanks, Rhonda. I appreciate it.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
Yeah, so I'm actually from the area. I grew up in Schriever and went to school in Houma. And of course, I had to go away to go to medical school and all that, but I always wanted to get back. So I'm really grateful to be back here. I did training in internal medicine in Baton Rouge at LSU. And after that, I subspecialized. I had to go to Nashville for that in palliative care. But after that, I'm really excited to be back where I started.
We're so grateful to have you back. I mean, after going to Nashville, that's a pretty exciting town, so we're lucky to have you.
Yeah. It's hip and happening, but I'm glad to be home.
Well, good. Well, when did you first decide that you wanted to get into the medical field?
So nobody in my family is in medicine. So I grew up, I really like science, but I liked people even more than science, and I figured that was a good intersection. And I remember one time, I grew up on a farm in Schriever, down Bull Run Road, and at one point my dad had cut his knee with a skill saw while he was working on something, and he asked me to stitch him up, and I was like, that was kind of fun, you know? I thought maybe I could do this. And then, so I went into science in college, and it just kind of took me into medicine from there.
Okay, and now you're in palliative medicine. What is palliative medicine?
That is a question I get a lot. So here at Terrebonne General, our service is called palliative medicine and supportive care. Those two terms are interchangeable. So palliative medicine is a branch of medicine that takes care of anybody with a serious diagnosis. And our goal is to relieve the burden that comes with a serious diagnosis and to support patients and their families as they're going through any serious illness. So that can look like a lot of things. For me, a lot of times it looks like helping with symptoms. So I do a lot of symptom management. And also, whenever care gets complicated, often a lot of questions arise. And we can also help a lot with taking communication between all these different subspecialists and really making sure that patients and families have all of their questions answered, and we can help them navigate those complex medical decisions.
Okay. And what types of illnesses or disorders do you treat?
So I work collaboratively with the subspecialists that the patient is already seeing. So often I'll help for patients with COPD or emphysema, with heart failure, patients that have a cancer diagnosis. And I don't replace their cardiologist or their pulmonologist or their oncologist or even their primary care doctor. I collaborate with those doctors to make sure that their symptoms are under control. So for heart failure and COPD patients, often we'll help with things like shortness of breath, trying to get them so they can walk a little further at home and their life can look as normal as possible at home. And for patients with cancer, things that I'll help with are often pain related to cancer or nausea and vomiting sometimes that comes with therapy, and try to get those symptoms manageable so that their life can look, again, as normal as possible.
Right, the quality of life is what you're trying to preserve. So how do you help patients in the hospital?
Yeah, so I see patients both in clinic and in the hospital, and often whenever somebody comes into the hospital, it's because of a crisis. Something went poorly at home. And so part of what I do is try to come up with a plan to where whenever they get out of here, hopefully they don't have to come back to the hospital. And so that can look like getting their symptoms under better control. And also, if there's new medical information that becomes available during that hospital stay and there's new decisions to make, I can help them kind of sift through that information with their subspecialists and make a plan that makes sense based on their priorities.
Right. And why is this specialty so beneficial to patients?
So a serious illness, I can speak from experience in my family, it really turns your life upside down. It changes what your everyday looks like, what you're able to do. You have to think about when to take your medicines. It can change a lot of things. And our goal, while we're trying to treat the illness, is also making sure that your life is as good as it can be, for as long as it can be. And so I think it's worth a lot of times taking the time to think about those questions. What symptoms are affecting you every day? What can we do to manage those? Mm-hmm. Do you need more help at home for things to look normal? Especially, I also have some patients with dementia, and I feel like a lot of times I take care of the patient, but caregiving is also very challenging. And any way I can support the caregiver is also another service that we can help with, getting them the resources they need.
Oh, that's wonderful. So what are you most excited about for your career here at Terrebonne General?
I'm mostly excited to be home and get to take care of the same patients for years. It was hard moving around, and I really get attached to my patients. And so it's challenging whenever you get really close with a family and then you have to tell them that you're moving away. That was never fun. That was my least favorite part of training. Mm-hmm. And so to be able to be back and be with the people that I grew up around is just exciting.
I'm sure everybody's glad to have you back as well. And do you see patients in our clinic?
Yes, so we're hoping to expand our clinic services, but since we're getting off to a new start and I'm mostly in the hospital, my clinic days right now are Tuesday and Wednesday afternoons. And hopefully we'll see if we can gradually expand that, but that's where we're starting.
Okay, and how do patients get to see you?
So to get an appointment, it usually comes by referral. Sometimes if I've seen a patient in the hospital, then it makes sense for them to follow up with me in clinic, and it can happen that way. But for patients that normally follow with their subspecialist, if their subspecialist thinks that they could have some help with symptom management or there's something else that we could help with, they can send a referral our way.
Well, it sounds like a very interesting career in practice of medicine, and we appreciate all that you're doing, and we're so glad you're back home. So welcome home.
Thank you so much, and thanks for having me.
For more information on Dr. Logan St. Cyr, or palliative medicine at Terrebonne General, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.